is Forrest. I want to be your nurse for today. I was just wondering if I could do a quick head-to-toe assessment. It'll take about 10-15 minutes. Is that okay? Yeah, sure. All right, great. So I'm going to go ahead and wash my hands first. Give them some privacy. Close the curtain here. Going to make sure your wheelchair is locked and your bed is in lowest and locked position. Okay, great. Now, to start, I'm just going to ask a few questions. Could you tell me your name and date of birth for me, please? Mr. Sloth, January 1st, 1955. Great. I see that name and date matches your wristband and also matches the records that I have. Another question, do you know what date it is today? October 2nd, 2020. Great, okay, that's the right date. Do you know where we are? We're at the hospital right now. Do you know why you're here? I fractured my hip a couple days ago. Okay, great. That matches all my records. Patient is organ-oriented ×4. Alright, Mr. Sloss, so I'm going to go ahead and move on and checking your eyes. So if you can go ahead and cover up your left eye, and I'm just going to shine a light in your right eye. If you could just keep your eye on my nose for me, that'd be great. Okay, go and cover your left eye. Okay, I'm looking at his pupils, making sure they're reacting to the light. Cover your other eye, please. Okay, great. Seems like his pupils are round and reacting to the light appropriately. Now, Mr. Sloth, one last thing. If you could focus on this tip of the pen and just move your eyes, okay? And follow the pen. So as I'm doing this, I'm making sure he's just moving his eyes, making sure the eyes are moving smoothly, and they're both looking at the pen. Okay, great. Thank you so much. Now I'm going to check your peripheral vision. I'm just going to put my hands behind your head and just let me know when you see my hands, okay? I see him. Great. His peripheral vision is intact. Okay. I'm going to go ahead and just check your sensations. So just let me know if this feels equally on both sides. Equal, equal, equal. Great. All of his limbs, all his sensations are equal. That's great. Now, could you shrug your shoulders for me? Shrug your shoulders. Can you puff out your cheeks? Can you stick out your tongue? All right, you did all of that. Everything looked equal. Sensations are reacting. So now I'm going to go ahead and move on. Could you stick out your arms and then chicken wing for me, please? And just, okay, great. Now I'm going to push down and resist. I'm going to push up, resist. Great. Okay, now again with your legs, can you kick them out? And I'm going to resist. Push them back, resist. Great. All of his extremities are equal strength. Now, Mr. Sloth, I'm going to ask you to stand up for me, please. Okay, can you close your eyes? Well, first, before you close your eyes, hold your hands out like you're holding a pizza box. And then close your eyes for about 5 seconds. Or 10 seconds. There's no pronator drift. Okay, you can go ahead and open your eyes. Great. Now while you're standing, could you just walk to the door and back for me, please? So as he's walking, just looking for his gait, make sure it's steady, make sure there's no unequal on one side. He's not limping or anything. Great. Your gait seems steady. Now you can go ahead and sit back down in the wheelchair for me, please. Great. Now, Mr. Sloth, I'm going to go ahead and move on to listen to your heart. Do you mind if I listen underneath your gown? Is that okay? Yes, that's fine. Okay, great. So I'm going to listen to the aortic, the pulmonic, Erb's point, tricuspid, and then finally mitral. All right, great. Thank you, Mr. Sloth. Oh, my stethoscope just broke. Heart sounds are normal, equal, normal rhythm. There's no adventational sounds such as whooshing or wheezing or any unequalness. That's great. Now, Mr. Sloth, I'm just going to check your peripheral pulses, your radial pulse here. Alright, that's strong. I'm just going to check your capillary refills while I'm here too. So I'm just going to press down your fingertips. Refill is less than 3 seconds. That's awesome. Now I'm going to move on to your foot here. Check your pedal pulse. It's on the top of the foot. And then your posterior tibialis. That's right next to your ankle. Great. All the peripheral pulses are strong and equal. I'm going to check your capillary refills, on your toes. Less than 3 seconds as well. Great. Capillary refills, pulses are strong. Capillary refills are fast. That's what we want to know. Okay, moving on. I'm going to listen to your lungs. Would that be okay? Yes. Okay, great. Now, for me to really listen to your lungs, I need you to take a deep breath in and out every time I place my stethoscope on you. Now, if at any time doing this you feel faint or dizzy, just let me know and we'll stop, okay? So I'm going to start with the front here, make sure my stethoscope is actually attached. Alright, I'm going to listen to your back now. After the 4 spots in the front, listen to 6 on the back. And then 3 on the right side. Two on the left side. Okay, you can go and turn back around. Okay. All the lobes sound clear. There's no cracking or any signs of fluid or neural thorax at all. It all sounds clear. Equal. No crackles. That's great. So, I think we're going to move on to listening and assessing your digestive system. So if you just lay on your bed for me, please. That'd be great. Thank you very much. And if you could just pull up your gown just a little bit, that'd be great so I could see your tummy. Okay, now as I'm inspecting, before I touch it all, I don't see any signs of distension or hardness or any abnormal lumps down there. So I'm going to go ahead and listen to your bowel sounds really quick, okay? Just in 4 spots. I'm listening for bowel sounds, making sure they're not hyperactive or hypoactive. Great. These are normal active bowel tones. That's great. Now next I'm just going to palpate. I don't feel anything firm. Everything's pretty tender. That's good. That's what I want to feel. Okay, Mr. Sloth. That's great. If you could just tell me, have you been experiencing any nausea, vomiting, or diarrhea lately? No. Okay, that's great. Could you tell me the last time you urinated? Urinated this morning. Okay, and was the color clear to light yellow or any really significant foul smells? No? And yeah, it was about yellow tint. Okay, great. When was the last time you had a bowel movement? I had a bowel movement this morning before I ate breakfast. Okay, and was that just, was it formed? And was it, usual brown color? Yeah, it was formed and had a normal color. Great, that's awesome. So, while I've been doing the assessment, I've been looking at his skin. I didn't see any signs of tattoos, no scars. There's equal hair distribution throughout for a sloth. No signs of edema. skin is moist, normal color, no signs of tear, no scars at all. Now, one last thing, Mr. Sloth. What's your current pain scale? On a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you ever felt in your life. I'd say my pain level is about a 2. Okay, his pain level is about a 2. I'm going to ask some follow-up questions. Where's your pain located? It's on my right hip. Okay, I'm just going to ask a series of questions. What kind of pain is it? Is it like aching or sharp? Is it acute pain, chronic pain? How long have you had this pain? Does anything make it better or worse? It's just kind of aching pain. What makes it better is when I lay down, and what makes it worse is when I am up walking. And it's just acute pain. It's just ever since I fractured my hip. Okay. All right, great. Let me see if I can get any pain meds for you, or some Tylenol or something. I'll have to check the chart. Okay. But otherwise, that's great. I'm just gonna make sure. Thank you for your time, Mr. Sloth. I'm gonna go ahead and wash my hands. Just make sure the bed is in the low and locked position. Go ahead and give you the call in, Mr. Sloth. Don't hesitate to call if you need anything, alright? I'm gonna undo the curtain, and then I would document everything that I just spoke to you and that I assessed and recorded in my mind and as I was doing the assessment. Great, thank you very much, Mr. Sloth. Wash my hands. Bye-bye.